All right, Richard Terendi's joining us with Vision Quest 2020. It's not a video game. 1 in 4 kids are affected with vision disorders. Is that correct, Richard?
Yes, it is.
And, what do you consider, like, is that anything from they just need glasses to something more serious?
Well, in the vast majority of cases, vision disorders are typically treated just with prescriptive eyewear. But, yes, in some cases, surgery is necessary or sometimes patching. It depends on the extent of the problem. But the good news is that most vision problems are easily treated.
But lots of times we have no way to know it because the kids don't even know how to describe it. Is that right?
Oh, you're exactly right. And in fact, that's really the problem. The problem, ironically, is not the vision disorder itself, although there certainly is a problem when the child can't see, and there's a slew of issues, the way that it impacts the child is certainly far-reaching. But the real epidemic is the detection of vision problems. And so you're exactly right. I mean, think about it. If a child has never seen the world clearly, how do they know any different, and how are they to articulate that? And the other problem is that parents and teachers and grandparents and friends often aren't aware that there's a problem with the child's vision either. It's not something where you can look at the child and necessarily see that they have a vision problem.
Right. So what exactly is Vision Quest 2020?
Well, I had the privilege of co-founding Vision Quest 2020 in 2003 with a nationally recognized children's eye surgeon, Dr. James O'Neill. And the impetus behind the founding of the organization, it's a 501c3 nonprofit, and the impetus behind this was that Dr. O'Neill was very troubled by the fact that virtually every day he would have to inform a family that their child had irreversible visual loss due to this condition called amblyopia, or commonly known as lazy eye. And amblyopia is particularly nefarious because the child can typically see very clearly out of one eye and blurry out of the other eye. So this is a child that can actually read a book, see the blackboard, and appear to be functioning perfectly well. And the problem is that by age 9, if it's not detected and treated, the vision center of the brain is pretty much cemented in place. And so the neurological or the electrical connection between the eye, the blurry eye, and the brain is disconnected. So this is a public health dilemma that impacts between 2 and 5% of children. There are 5 million adults in this country alone that have monocular blindness due to this condition simply not being detected. It is the leading cause of preventable blindness in children, and that was why we founded it. However, upon researching how important vision is, we wanted to go beyond just the detection of amblyopia. We want to detect anything that adversely impacts a child's ability to see.
Wow, that's incredible. So now, is that the ISpy system in schools?
Yes, ISpy 2020 is the result of years of research and a lot of programming and sleepless nights, taking an approach to testing children where you remove all of the psychosocial barriers that are associated with a traditional vision screening. You know, children can have quite a bit of trepidation about being tested, particularly an eye test, which causes them perhaps to not perform optimally, or worse, they may even cheat. They could memorize the wall chart. They could peek through their fingers. Traditional vision screenings are subject to a lot of human interpretation, for lack of a better term. So what we wanted to do was basically make something that would be fun and engaging for the children so that there would be no incentive for them to necessarily cheat, and also make it extraordinarily easy to use so that schools could engage volunteers or perhaps even older children to come in and administer a vision screening without any training whatsoever and know that the results were highly accurate and very reliable.
And how many schools are there a lot of schools around the U.S. that are already using this system?
Well, we are just starting to proliferate the system across the United States. We've really made inroads in Arizona where we're based. We've got several hundred schools in Arizona using it. In the past 3 years alone, we have vision screened about 200,000 children. And in fact, I should say that it's not our organization that is vision screening the children. It's the schools themselves. So we wanted to vet the system out, make sure that everything was working perfectly, not from a medical standpoint, but from a scalability standpoint. And so all of that is now in place and ready to go, and that's why we're talking to you.
So then how does it work exactly, the Vision Quest 2020?
Or you mean ISpy or
the ISpy. How does that? They just go in and it's an easy test?
Yeah, I mean, from the child's perspective, they're simply playing a game for about 2 or 3 minutes. From the proctor's perspective, all they really need to do is type in the child's name and their birthday and press go. So it is pretty much that simple. The software is delivered over the Internet, and the schools are emailed an activation code, and they're also provided some of the supplies that are necessary to conduct the vision screenings. But the schools really benefit from a couple of things that ISpy offers above and beyond an accurate vision screening, and that is to say that ISpy collects all of the data and immediately generates a report that can be printed immediately after the vision screening or at any point in the future. The schools have access to this data forever. So if a child is vision screened every year, which we recommend, they can look at that child over time and
see if there's any changes in vision.
Exactly. And the other thing is that ISpy integrates with the school's health information system. So schools are becoming more electronically, record-driven, as we all are. And so ISpy will take the vision screening results and pump it into their system for them, and that saves them a ton of time from having to manually enter it. And, of course, whenever you do manual data entry, you're also subject to errors. At least I am.
Right. Now, so what happens then? It generates a report, and then the kid could take the report home to their parents, and if something needs to be done, they go see an ophthalmologist?
Or an optometrist, yes, an eye care professional. So every child that gets vision screened, whether they pass or fail the vision screening, the school has a couple of options. One, they can provide the child the vision screening report. They can mail the vision screening report to the child's home, or they can email it, depending on their student information system, depending on their capabilities. But, yes, notification of the parents is really the critical link. And that report, if the child is recommended to be seen by an eye care professional, there's actually space on the report for the eye doctor to check off a couple of boxes which will dramatically help the school accommodate those child's needs.
Cool. And so as parents, so do we need to be a little bit more proactive with our school system to get this, to get Vision Quest in there, get ISpy in the schools?
Yeah, here's a couple things. As parents, grandparents, as, advocates of children in general, I think there's a couple things. I mean, one, we don't want to assume that our children are getting vision screened. Things are different now, so budgets are being cut, changes are, schools are constantly trying to figure out ways to save money, and I'll talk about how ISpy can actually help them do that in a minute. But let's not first assume that children are being vision screened. Secondly, even if they are being vision screened, I hate to say this, but don't assume that it's accurate. I would love to sit here and say, look, any vision screening is a good vision screening, but here's the problem. That isn't true. If I, as a parent, get a vision screening from my child's school and it says the kid passed, I'm going to assume that means there's no problem.
Right.
And so as parents and grandparents, we really have to advocate a little bit stronger. We have to go in and we have to say, how did you vision screen my child? And if you're using a wall chart that was developed 150 years ago, vision screenings haven't changed in 150 years. If that's what you're doing, that's no longer adequate.
Richard, we don't have much more time, but it's excellent points. I want people to know where to go. VisionQuest2020.org is the website.
Yes, sir.
And people can go there, find out more about it. Richard, we're about the end of our show, end of our time. We want to thank you for joining us today. Very interesting. Thanks for being with us. All right, we'll be back tomorrow right here, AM 1470 WMGG. It's Evan and Deb in the afternoon.